Good afternoon, everybody. Can folks see my screen okay?
Yes.
All right, great. Welcome to June office hours. I wanted to let everybody know we're recording as usual, and if folks have questions along the way, feel free to ask. We have the chat function as well for folks if they have questions along the way. And we'll have this office hours up on our website in the near future as always. With that, we'll get things started. We're going to go over NetSmart attachment documentation issue in this office hours. We'll talk about the plan of care compliance concern. We'll review redesignation audit for the plan of care. We'll touch on the OMIG audit from 2017 through 2019. We'll spend some time talking about BTQ. We'll touch on the DOH 5055. There's a change with the consent form that's coming, that's going to go into effect. HCBS for adults update, and then children HCBS update. So with that, I'm going to jump right in. As folks are aware, we had a NetSmart documentation failure that Lead Health Homes were notified of. AHI, Lead Health Home, was notified of this failure on June 1st. Initially, we were met with NetSmart on the 1st of June. They provided us information of over 35,000 documents were lost, and brought that information to us, which we let the Department of Health know immediately on June 1st of that, as well as the downstream network of that incident. NetSmart since updated that number and time frame on the 4th of June to DHI to change from an October 1st time frame to a September 13th time frame of 2025 to May 21st of 2026. And then they changed the documentation from over 34,000 documents lost to 26,652 documents lost in the platform. And that is the current stance of documentation that's lost.
At my training, if you need anything, please contact Karen. She's gonna be there too.
So we've taken that information, we've communicated that as it's been provided to us to the Department of Health. We've been in contact with the other Lead Health Homes that have been impacted, met with them twice. In particular around this, those other health homes are Bassett Children's Health Home of Upstate New York, Community Health Connections, and Honey Health Homes of Upstate New York. We've talked with those other leads. Combined, those leads constitute 9 Lead Health Homes that are impacted by this. And we've been communicating on to best coordinate moving forward. We've requested a meeting with the Department of Health, which will be happening later this week, which I'll be showing you on the next slide here coming up. And we also have had a meeting with NetSmart, which I'll be sharing with you on the next slide coming up to talk about the information we've been requesting with them. So the notification to the Lead Health Home Director for DOH was made on June 1st. And we made sure to do that as well. And we've also been in connection with our legal counsel throughout this process on advocacy on behalf and finding out what options we have to move forward in this situation. So I just wanted to pause for a moment. If there was any questions, anything come through the chat. Jessica, if you've seen anything come through thus far.
No.
Okay. So we're going to continue to update on this front as we're getting information. I know we've also asked each CMA supervisor to work with each organization's team to provide updates for documentation into the system as we're trying to get information back in. We really appreciate that. We know it's a huge undertaking, understanding that, this is a NetSmart failure. But we're also going into a redesignation review in the month of July, of which we're trying to prepare for, which DOH is moving forward with. So we're trying to do what we can to get that information back in. As I was mentioning before, we met on the 18th of June with NetSmart as lead health homes impacted by this situation. Started to have discussions with NetSmart how they can take action to create documentation that would acknowledge measures to validate and standardize the missing documentation issue. So we had discussions as leads with NetSmart around this. The next step that NetSmart's going to take is to provide us as leads various examples of templates of documentation to review for us to look at, to potentially implement and standardize through NetSmart system, since there's a number of care management agencies that use NetSmart across leads. We want to have that standardized as much as possible so that users can go into different tenants through NetSmart and have consistent flow of forms, if you will, or documentation standards. So NetSmart is working on that, and will be back in touch with us in the very near future, and we will be looking at that as next steps with them. The other thing we're doing as a lead health home, as is the other lead health homes, is we're required within 30 days to do a disclosure to OMEG, as OMEG requires this for any loss or destruction of documentation. That reporting has to occur to OMEG by their standards. Since we were notified on June 1st, we have to do that notification by July 1st of 2026. So we're in process of going through that right now, and taking that information from what's been reported to us by NetSmart. We're working with NetSmart. We're requesting information from them to complete that process with OMEG. So I just wanted to pause again. If there's any questions, comments, anything from the chat.
We're required to provide those, what we cannot recover to you by the 1st or by the 24th?
I'm sorry, Kai?
Are we required to provide you with the documents that we can't upload? Because it says you're following OMIG standards for loss or damage records.
We have to report to OMEG that there's been a disclosure that there's
Okay.
been lost records. That's something we're required to do as a lead, because NetSmart's lost the documentation and records, so we have to do disclosure that's occurred. So that's something the lead has to do. That's not anything that you would need to do as a provider. Did that answer that question for you?
Yeah, it would just confuse me because I thought that we had to provide you with also with the documents that we were able to recover.
Oh, I'm sorry. No, this is something we have to
Yeah.
do as a disclosure because the event occurred. Is there any other questions around this?
Hey Travis, I have a quick question.
Yes.
I was just curious if, as a plan B, if an organization were to store, copies of care plans and other documents in their environment, is that going against our BAA in any way or any sort of system security protocols?
I don't think that would be the case. I mean, if your environment's secure and you're keeping record of a document, I don't see an issue with that. I mean, we have an internal secure drive in our organization where we maintain records. The BAA is in place for purposes of an arrangement with the organization for business purposes. I mean, you having copies of the documentation, I don't foresee an issue with that.
Thank you.
Any other questions? Okay, so we'll keep moving on. I mentioned earlier, we were requesting as Lead Health Homes a meeting with the Department of Health. So we have that meeting scheduled for this Thursday at 2 o'clock. One of the things that Lead Health Homes, as we met on those 2 instances thus far, is we've been trying to come up with some advocacy around of the documentation that's been lost. Is there any ability for negotiation on what could be potentially looked at for flexibility by the Department of Health on documentation requirements? So that's going to be part of a discussion with the Department of Health. We don't know if there's going to be any movement on that, but that is one of the things we're going to be talking with them around this process with the documentation lost. The other thing that we have done as a Lead Health Home is we've requested a 90-day extension beyond our 6/30/26 plan of care audit. So we're asking for an additional 90-day extension. We put that in writing formally. We initially asked verbally when we met on our TA call at the end of last month. And then we followed up in writing with that. That's still pending. And we also asked for, and verbally in that meeting, the TA called and then put in writing formally a consideration to reduce the 95% threshold for that plan of care audit for the children's review to be reduced, because the time frame of our audit period for the plan of care audit for children's falls right into the heart of that 9/13/25 through the 6/30/26 plan of care audit review. So we're asking for consideration due to the fact that that is right in that timeline. And then as we've communicated with the downstream network, we're also working very closely with our legal counsel to determine appropriate action steps to continue to support our partners throughout this process. So I just wanted to pause again if there was any questions or thoughts or commentary that anybody had at this point on this particular slide. Okay, we'll keep moving forward. One of the things I want to note before I get into plan of care compliance, that the documentation, I truly appreciate the HI team appreciates all the efforts that everyone's putting forward. Clearly, this is a tremendous effort and lift. We've asked organization supervisors to really take a look at the time that's being put into this and to monitor that. We truly appreciate the organizations that have reported back their efforts and provided us the documentation that they've found and submitted that back to us. We're starting to get those back from organizations, so thank you very much. We're monitoring and tracking this. We understand it's a huge undertaking, and we just want to truly thank you very much for this. And just know that we appreciate it greatly. The plan of care compliance concern, the audit timeframe, as everybody well knows, is that August 1st, 23 through October 22nd, 25. We met with the organizations. We extended that extension for the contemporaneous notes. That timeline went through June 12th. What we've gone through at this point is we've gone through about roughly 41% of our review of those resubmissions and gotten out the door to organizations the PDF acknowledgement forms. We have actually 7 signed off, and there's we had mentioned in the past we've had a few organizations that didn't have any take back scenarios. That so they have, you know, a situation where they would sign off on a form where there wouldn't be any instances where they would have a take back. So those forms have been sent and signed, but the other 7 are out and return for signatures, and we're continuing to work through those situations. So we're pushing through, working with organizations as we're getting those reviews completed, and we're really trying to, you know, we're trying to push forward as fast as we can to get those reviews completed as those and, you know, those reviews happen. So just want to give folks an update on where we're at with that. And as we've reviewed in the past, you know, those gross claims review will be recouped from organizations once finalized, and we'll be coordinating as a lead with the fee-for-service Medicaid and the MCOs on what that take-back process will be coordinated and look like in the coming months. Likely, you know, we're projecting in the months of August. If we can get that extension, it may adjust that timeline, obviously, but we have yet to hear on that from the Department of Health. So I'll just pause again. If there was any questions or commentary or anything from the chat on the plan of care compliance concern.
We do have one question in the chat. Brandy is asking if there is an expected time frame for the repurpose for response from DOH on those requests for the extension on the plan of care audit for redesignation.
As far as could you clarify a little bit further? Every small time frame.
Yeah, I think she's asking if there is if there's a time frame on when DOH will respond to our request for the extension.
We
And
asked
we
for
haven't heard anything from them, and they did not say we would hear an X time frame, correct?
right. They said
Yeah.
as soon as possible they would get back to us, and that's been a little over a week now, a week and a half since we put that request in writing. Because we did it immediately right after we were notified about this situation with the documentation failure. What we have been able to do, and I didn't note this and I should have to all of you, working with DOH with the redesignation send sample poll, they're willing to work with us for the plans of care that are missing in NetSmart. They're giving us a little bit, I don't want to necessarily call it leeway, but they're being flexible with us to look for that documentation versus being quote unquote audit ready. So if it's not in there, you know, they're going to give us a little bit to search for it. So that is something that they have established with us in discussion, understanding that the failure on NetSmart's part with this documentation destruction has clearly been out of our control, out of everyone's control. So we do have that commentary that's come from the Department of Health. But as far as a time frame expectation on a response on when they're going to give us an answer, we have not got that clarity. Is there any other questions around the plan of care? Charles?
Hey, Travis. Sorry if I'm making you repeat yourself. For the deleted documents, I know the list is due back to tomorrow, but for us, we have a lot of ours to upload. Does that need to be done tomorrow as well? Like uploading all the documents that we can put back up, or just letting you know the yes or no on that?
So you've already done it, you're saying?
Well, so we have like 980 that were missing, and we can upload most of them. I didn't know if that needed to be done tomorrow, uploading the ones deleted, getting that list back, getting that.
we'd like it if you could get those uploaded as soon as possibly reasonable at this point, understanding the burden behind it. Obviously, this is very difficult and a hard thing for organizations with resources and limited resources to fully understand that.
Okay, yeah, and we'll,
If you wanted to talk offline on a timeline on this, we were willing to talk through that. But we're asking the organizations to try and get those documents back in if at all possible.
Okay. Yeah, absolutely. Thank you, Travis.
Yep. Any other questions?
Yeah, to piggyback off that one, I know I asked you, Travis, about the discharges. So we have completed nearly all of the uploads for the missing documents for the current clients that are enrolled, that are still with us. But I did have that question about the clients that we have already discharged that have missing documents. Do we have any word on that?
There's not really going to be any exception on it's going to be anything that could be potentially auditable. So if someone's going to be audited and if they were enrolled in the program at any point and they had a plan that was active in the timeline that would have been audited, it's going to be something that could be identified as applicable for that time frame.
Okay,
So-
that part makes sense. Now,
Yeah.
I have a follow-up question to that. For the clients that are discharged and they're missing several documents, can we upload them together? Or do they have to be individually uploaded, saved as the new name or as the right name, and then uploaded? Because that's the time-consuming part. If I can take a whole pack and upload them under that one client, that would be such a time saver. And just label it like missing documents.
I think we're going to, my initial response to that's going to be, it should be document per entry. I don't believe grouping them is going to be, because we would have to get clarification otherwise. I think it would have to be per entry. Jessica, I don't know if if that would be, I think we'd have to get clarification otherwise.
Well, we do have the audit trail of the individual documents that had been uploaded. And we are working with NetSmart to put some sort of notation in the system that would notify an auditor that that record does contain missing documentation and potentially an exact list of what those items are. We
We'd
can
have to
talk
get-
off, we would talk
Yeah.
offline, but I think it might be, we'll talk offline and we'll get back to you.
Yeah, I
Okay.
think the issue is we have to get state approval on whatever document process we get. How we would get it requested to the state. They're saying they want to approve it. That's going to be the only piece to it. If it can happen, it makes total sense.
We could get clarification at that meeting Thursday, Travis, for
Yeah.
DOH.
Yeah. Yeah, I think that'd be the safest bet.
So are we gonna push back the due date from tomorrow till sometime after that then?
Yeah, I think people can continue to try and enter the documents as much as possible for that grouping scenario that you're talking about. We can get clarification on it, and if it's something that's doable, then it'll speed up process at that point. I don't want to stop the process. I mean, the bottom line is if OMIG were to come in and do an audit, they're going to audit and they're going to look to see if things are in or not, period. And that's the bottom line of the situation. And that's the reality that's being faced. So, you know, we're trying to see and get information back in. If it's out there and people have it, that's the best case scenario.
We do have another question in the chat. Anna's asking, what is the guidance for organizations who did not save backups of the missing attachments?
I don't think if you don't have it, you don't have it.
If I could, Travis, so part of the, it's Karen, folks, part of the meetings we've been having with the other leads was to really look at each of the documents to say, okay, yes, needed, can't find, how do we then together kind of collectively take that approach? And that's part of the discussion with the Department of Health. So not a great answer, understand, but you know, trying to prioritize things that will need to be redone, not backdated necessarily, but how do we deal with that with DOH? So more to come on that, Ann.
Yeah, and we understand that a lot of the EHR is supposed to be the record of truth, the sole record of documentation, and you know that's understood from a lot of other organizations, and that's been brought forward through this process. So that's you know, that's been coming up in conversation through discussion. So you know, that's one of the things that's brought up this discussion point through the Lead Health Homes as we're approaching DOH in our collaborative effort. But we just don't know how the response is going to come back yet. That's we'll have to see how that pans out. Another question?
Travis, this is Tanya. I have a quick question. I was actually waiting to see if anyone else had the same question. So kind of follow up to our chat on Thursday, the disclosure, you guys having to have the disclosure to OMIG as of July 1st. I'm wondering if you've been able to find out if there's any more risk of the CMAs risking another payback once OMIG finds out that the documentations were missing when we essentially submitted bills for that.
Right. So at this point, we know we have to put the disclosure forward to OMIG based on the lost documentation. We're moving forward and billing as normal as the other Lead Health Homes, because there's a trail through NetSmart showing that documentation was uploaded and there's connectivity through their system. We are going off the premise that there was uploaded documentation, and it shows that there was time, date, and stamp showing that had occurred. That's where we're at this point. So we don't have any more information. We're working as we're going on that. So I don't have more in-depth answer than that at this point, Tanya. I know I said the same thing to you last week when you asked the question. We're working through this as it's unfolding.
Okay, thank you. And my one other question was, for the CMAs that haven't yet gotten the acknowledgement and agreement, that second one for the payback, is there a time frame of when we might be getting that?
Yeah, we're trying to get those out as fast as we can.
Okay.
There are only a couple people working through this.
Okay, I just want to make sure it wasn't something we missed.
No, there's just a couple people trying to work through this, and so it's, as you know, it takes time. But we're trying to diligently get through this. So
Thank you.
We'll be in touch. Were there any other questions around the plan of care? Okay, so we'll keep you posted as we know more. So the audit itself, as we were talking about, just to reiterate, it's 50 sample charts that they're going to pull. They're looking specifically for an manual signature date requirement to ensure that it's in compliance. It's going to start July 1st. At the moment, it's got to be a 95% or higher threshold for the chart review across the board. DOH did send out a list of SINs to the lead in preparation. It was a good portion of those SINs were electronic signatures. They've since reached back out and they're asking for an additional pool of SINs that are manual signatures. So they're asking us to work to look at that. So we're trying to work with NetSmart to pull all SINs that were between January through June that were children's plans of care that were manual plans of care, and we're supplying that to the Department of Health, and then they'll from that poll a random sample. And so we have already reached out to some CMAs around manual signatures. We'll be reaching out again to some other folks if they're not in the chart for plans of care to see about uploading if you have them. But that's ultimately what will be happening. They'll be looking at plans of care that are manual signatures to be present in a chart and in alignment with the finalized date to the date of the plan of care. And that'll be throughout the month of July. Our OMIG audit, changing gears, which was October of 2017 through June of 2019. That's still continuing. We had our draft audit report, which we submitted on May 29th. It was due by June 1st. Currently, OMIG is reviewing our submissions. Again, thank you to those organizations that were able to submit some documentation. We did submit some items that are being reviewed currently. We're going to have another option to have a potential to respond again once more. OMIG did report to us through their final audit report, which they'll send to us at some point. Upon receipt of that determination, we'll be in touch with those providers that have potential impact depending on what the results are. And we'll talk about next steps at that point. It's hard to say when we're going to be back in touch. It could be in a month, it could be a couple months, it could be a few weeks. They were just in touch last week saying they were actively reviewing the information. So hopefully it's not going to be too awful long, considering September is going to be 3 years that we've been going through this process with them for this particular time frame. So I just wanted to pause if there's any questions on this particular OMIG audit that was being reviewed for this timeline. Okay. All right, so other gear we'll switch to BTQ, a billing platform. So as we mentioned, we were going to be changing vendors. We're effectively, as of July 1st, going to be switching over to BTQs and starting to transition from MillenPro. Our MillenPro contract actually ends the end of August, but effective July 1st, we're going to be starting to work in BTQ. So we're asking that all billing is completed and finalized within MillenPro no later than July 10th, so that we can ensure that our billing is finalized and all set. We want to make sure that the June claims are all taken care of, so that's all set so we can move forward. And there's been trainings throughout this month, as folks know, the supervisors and financial staff that they've identified through their organizations have started to attend. They're going to continue throughout the month of July and August and potentially following that. Each organization will be able to have as many portal staff as they'd like to have as part of BTQ portal. And that'll be a nice thing. And there'll be reports that you can print off. If you contact that you can have directly with the BTQ staff, through email, through phone calls. They have like an active chat feature that you can get in with them. So there's a lot of ways to get in good contact with them on a frequent basis that we're looking forward to, that currently does not happen with Millen, that we're looking to as a big positive moving forward. And the reports that they also offer, as folks are starting to get the overview, I believe are going to be a little bit more in sync with what the questions that we get asked quite a bit from each of you are asking, that are going to get you the answers that you're hoping to receive in a more timely basis and in an automated fashion. So we're really excited about that. And we're looking forward to that transition. One of the things that I wanted to reinforce to folks, for your finance teams, in particular for us supervisors out there at each agency, please make sure that you get your reconciliation reports taken care of out of Millen by the end of July. Or I should say by the end of August, because at the end of August, access to the Millen portal is going to end. That's when it turns off. That's when the actual portal is going to turn off. So any reporting that you want to pull out of there for reconciliation, etc., you want to make sure that you get that taken care of before then. So just wanted to stress that point, and we'll send a note out to the supervisors prior to that, just to remind, but I just wanted to note that today as well. But I'll just pause if there's any questions around BTQ as we start to move forward, transition.
Yes, we do have one question. Allison is asking, when will we have full access to our BTQ accounts?
Yes, good question. It should happen within the next couple days. We were just on a call earlier with Amanda, one of the BTQ staff, and she said they're finalizing all the portal accounts, and they're hoping to have that active before the end of the week, actually. And they just about got done uploading all of the data, if you will, for the revenue and fields and all that stuff. So people will actually be able to see the organization's information and whatnot once they get in. So it'll be very shortly. Any other questions?
Oh, I'm sorry. Can you hear me?
Yes.
Allison is asking if there is a BTQ user guide that they can have access to.
It's a good question. We can ask. I can ask that question. A user guide. I would imagine we can find something out. I mean, they're pretty robust in every other area. So let me get back on that. You said
Paul
this was
has a
Allison?
Oh, yes, it was Allison. And then Paul just has a comment. Paul uses BTQ with another health home, and he just said that he's excited for BTQ and he thinks it'll be a nice change.
Oh, thank you, Paul. That's great feedback. We've gotten that feedback from other leads that use BTQ and some other CMAs as well, that they've been very pleased with the platform, and so we're excited for it. Anything else on this topic? Right. 50-55. So Department of Health on office hours this month announced that there's going to be a new 50-55 consent form that is coming into play, and there's some changes that resulted in the reasoning for it. The Rio is changing to the Shiny. Removed a reference to the 5058. That form was removed in 2022. There's added addition of language to share information related to HIV/AIDS status, mental health, and drug and alcohol use. Also include others that are legal allowed to receive and share health information. The UAS New York as a computer system was added to the, and then some redundancy for language was taken out. September 1st is when the implementation is to be used for all new enrollments. So that's something I want to really stress that folks would be aware of. So September 1st, you have to be using this for all new enrollments, the 5055 new form. I'm sharing a link to it, and I'll also send a new form out to everyone when I send out the deck today. So September 1st. By June 1st of next year, all members for the new DOH 55 is the appropriate consent instrument to have their update version and time completion, natural opportunities, obtain signatures, so the plan of care assessment, etc. So, and it just said here that you can use it as soon as it's posted on the website. So the English version set, they're in process on DOH website. There's a note saying that they're in process of translating to various different languages still. So that's still happening. The form has been extended from 3 to 4 pages just because of revisions. And that is the biggest changes. And then Shiny consent requirements, 52.1 was updated and include necessary language. So it took place at Rio. And then 5055 meets the criteria acceptable form as an acceptable form for local consent across the Shiny. So hopefully that's going to be true now as folks present, because I know we've run into issues in various venues where it's not been fully acceptable in the past. So those are the big updates with it. This is the actual form. I'm just showing you some quick screenshots of it. So you see some changes to it. And as you see, it went to 4 pages from 3. And then I put the link in the slide deck. Hopefully you'll be able to actually click the link right to the form itself. But I'll send the form along with the slide deck so folks can get right to it. But by September, you want to be using it for all new enrollments. Any questions on the DOH 55 new form?
Yes, we do have one question. Denise is asking, can we start using it now for new enrollments? So pre-rollout.
Yeah, it's available now. You just have to be using it no later than September. Any other questions on it? See, I think this is my last slide for the moment. HCBS update for adults. Just wanted to announce, I think there was actually a meeting on this yesterday. I wasn't able to attend it, unfortunately. So there may be a more recent update, and I apologize if there is, but there's some transition from behavioral health HCBS due to 1115 redesign. So the core services in HCBS, you got a low decreasing number of HCBS that are benefiting from core. So as a result, HCBS is going to be closing out, and the remaining folks are going to go to core and other existing services. So that is supposed to be occurring in the near future. And there was a call yesterday where there's supposed to be a discussion on what's supposed to be a transition plan on what next steps are along the lines for that, for the MCOs and of the like around that process. Jess, I don't know if you heard any updates on that from yesterday's call. But it's more to come on it. I know that much, but there is a transition coming forth.
Yeah, nothing to add, just like Travis said, that they will be working with those folks that are receiving HCBS to transition them into the associated core service. So they're not going to be losing any type of service. They're just going to go to the most appropriate service that crosswalks from HCBS over to core. But as we know more information, we will get it out.
All right. Any questions on this particular pending more information update?
One question, Karen is asking if we're going to be changing the HCBS core form in NetSmart to reflect this change. Yes, we will update our form in NetSmart as soon as we have final guidance from the state.
All right. Thank you. All right, Jess, I think it's you now.
Alrighty. So I just wanted to go over quick some children's update. It's really just one update and it pertains to everyone's favorite population of kiddos, our HCBS enrolled youth. So I just wanted to go over some high level changes that are going to be occurring for 7-1, because in July I will go over everything in detail. So the first thing I want to point out is DOH is really moving away from that CES language, and you're going to start hearing the term QIIS, or qualified individuals identified by the state. That is because Maximus, who was CS, was contracted to evaluate all of those kiddos going to HCBS for family of one. That responsibility has now been moved over to the Department of Health. So Maximus is no longer doing those evaluations. For our non-med population, that is now being done by somebody at DOH or qualified individuals identified by the state. So we have a new acronym. So if you start to hear that term, I just wanted everyone to be aware that that is the same thing as CS. It's just a new title. So as of July 1st, 2026, our members will have care coordination options just like they had when they were with CS. So as you knew before that once you were given Medicaid and you could access HCBS, you could move into health home care coordination, or you would kind of stay with the CS Maximus team and they would organize just HCBS services. They did not do any sort of comprehensive care coordination. So those options still exist. They're just slightly different because it has moved from Maximus now to the Department of Health. So first and foremost, health home care management obviously remains an option for everybody. So anybody who goes through the process of getting Medicaid because they're HCBS eligible, they will likely 99.99% of the time be pushed through into health home. That is going to be the best, most comprehensive option for these kiddos. Again, very complex needs. They really do need that hands-on care coordination. Also, side note, we have gotten referrals through this new process, and I will let everybody know it is seamless. It is nothing like the previous process. Very responsive. The referrals come in, very communicative. It's just going very, very well. The other option that they will have is they can stay with QISS or QIIS, that's a typo, as their coordination option, just like they could stay with CS before. So when they go to enroll, they do have the option to opt out of health home and they can stay with them just for those oversight of those services. So if that member is fee for service, so they're not enrolled in a Medicaid managed care plan and they are under the SCD target population, OMH will be overseeing those kiddos in their service utilization and those kind of service referral requests. If the member is medically fragile and fee for service, then that will be overseen by the Department of Health. And if they are enrolled in a managed care plan, so they have Fidelis, CDPHP, United Healthcare, whomever, the DOH or OMH, depending on what target population they are with, they will oversee that with that managed care plan. So what everyone needs to know is just like before, there are still those options for those kiddos that do opt out of health home care management. Again, the kiddos that you're seeing obviously have opted in, but there are still those options available. If you have a kid that you're currently working with in a non-Medicaid capacity and you do push them through this process and they choose not to return to care management, they have gone one of the other avenues. You can go to the next slide. So due to these changes, we do have a brand new policy coming out. It's the HCBS Waiver Care Coordination Requirements Policy. The reason this is a high-level overview is because I will be developing that policy and then I will do a review of that policy during July office hours. So I'll get that done. It'll get sent out to you and we'll review it in detail then. And then one of the things that needed to be updated was our transfer policy with CS. So it used to be the transfer between Health Home and CS. It has now been renamed transfer process between CS, QIIS, and Health Home Serving Children. Same policy, just slight updates because we are now looping in that QIIS. And due to the updated terminology, forms have been updated. So the freedom of choice form, notice of enrollment or denial, and notice of discontinuance, those forms have been updated for language purposes only. And then now we do have a new form that's being introduced, which is that DOH 5845. That is the transfer form. So you'll start to see that with your transfers that come in from DOH to us starting on 7/1. So there's going to be a brand new policy, and then there is going to be an update to the current policy and then update to forms. So what I'll be doing is I'll be rewriting the transfer policy. I will be creating that new policy, and then I will be incorporating all of the links to all of those forms in those policies. And then I will also update everyone's HCBS toolkit, and I will get that resent out to you so you have easy access to those forms, as well as the link to navigate right to the site to pull those down. So we'll go over this next month in more detail, but I just wanted to give everyone kind of a high-level overview of what is upcoming. Does anybody have any questions? All righty. Thank you.
All right, thank you, Jess. Right, the last slide we had, wanted to just put out there that we're looking to do some scheduling with supervisors for Megan DeMeo, myself, and then possibly some other lead staff to start to come around and get out to each organization over the next couple months. Initially for Megan to meet the supervisors and get a chance to go to each agency and just kind of get out there and make some connections and get to see where each organization's at for her, and and just talk through quality program and establish those relationships. So we'll be reaching out. It'll either be Megan reaching out or myself reaching out to set that contact up for Megan. But I just wanted to give that heads up. So look forward to that, and we look forward to making those connections with you all. And with that, that was all we had for this month. Not that that wasn't enough, but I didn't know if anybody had anything they wanted to talk about that we didn't have on our agenda or that we have discussed. All right. Well, I want to thank everybody again for everything you do, as you always do, and I hope you all have a great rest of your afternoon. Thanks again for everything. Take care,
Take care.
everyone.
Thanks, everyone.
Thank you. Bye-bye.